Hi, everybody, and welcome to the Dr. Mike and Shannon Show. And our question of the day is, can somebody on Workman's Comp be able to use the Uraval BRS as a diagnosis or a diagnostic tool? And Dr. Mike, you do have a practice that you work with that is using it as an assessment tool.
Yeah, I think this is an excellent topic of conversation because a lot of times when people get injured at work, it's sometimes difficult for the doctors who specialize in workman's comp to diagnose what is going to be the long-term effect to this patient based on this injury. And a lot of times we'll use MRI or we'll use X-ray to look at the different parts of the body. But as we know, a lot of times those things will miss certain elements. And so, when a person has workman's comp, right, they were injured on the job, and we want, even the insurance wants those patients to be, properly taken care of their, especially their health-based needs, right? So a lot of times what will happen is somebody will have a back injury, like a lower back injury, very common with a lot of our builders. The people, they'll fall off a ladder, something will fall on their back. It's a pretty hard life. Some of the
Heavy
good.
lifting.
Yeah, I mean, yeah, absolutely. Heavy lifting, all those kind of things. And all of a sudden they throw out their back. And so to be able to use the Uraval, which I know it's called the Uraval, but let's face it, it is a neurological device. It is testing the neurological response between the pelvic floor and the brain, and if there's a delay in that or not. But when you're injured, we find this even when a lot of our when we're talking about people that have traumatic brain injury or concussion-based situations with football players. And an interesting thing too, I don't know if you knew this or not, but if a football player is injured on the job, that's a workers' comp claim. Did you know that, Shannon? It is a
Did you hear that, NFL?
Yes,
NFL, this would be a
that
great tool
yeah,
for you to be able to
that's
use,
absolutely correct.
especially when your players are on their way out and retiring. Have that assessment done and make sure that way you have a baseline and if that injury was during their time that they were with you playing versus the time they got out. So
yeah, somebody gets injured on the job and all of a sudden they've got erectile dysfunction. All of a sudden they have urinary issues. All of a sudden they have constipation or diarrhea issues, fecal based issues. And we generally, if that's happening, what they'll do is they'll send them to, like, the doctor that I work with that specializes in urological workers' comp. And when it comes down to workers' comp, there's generally two sides of it, right? There's the patient side, and then there's the insurance side. And these are usually settled kind of in a court scenario. And a lot of times you'll see, on the side of the bus, when injured at work, call us today.
billboard.
Right, those kind of things. So our lawyers get involved with that to be able to help these patients confirm their level of injury, and therefore their level of injury directly affects what they're dealing with on what kind of medical help we can give them down the road to be able to help offset the injury that unfortunately occurred to them. So this clinic that I worked with, a lot of times these doctors will be put on the stand to explain what it is and why it is that they do what they do. And I always find it interesting for our urologists that work in workers' comp to not be doing a neurological assessment on those patients that have been actually injured. In my opinion, it doesn't make a lot of sense. It doesn't, work with the Merck manual and the guidelines that we talked about in previous videos. And yet we don't see a lot of these particular devices placed into workers' comp. And I would suggest, Shannon, that this is something that a lot of our workers' comp urologists that work for both sides of the aisle, so to speak, both for the insurance and for the patient, should utilize this to be able to properly diagnose level of injury. And the reason I say that is because, unlike the subjective matter of a patient saying, I hurt, I have pain, I'm numb, I have this, This is an objective measurement that clearly shows abnormal response or non-abnormal response. And so that's why I think in the eyes of the courts that help judge these things, an objective number is much more prudent than a subjective how I feel scenario.
And this is a benefit for both sides. So, both sides benefit from having this assessment, because now the workman's comp company, the insurance company, now they have where they were at, and they can now see improvement or non-improvement, but they can, now request to have this test done as well and have this assessment done.
Right.
Because that way, they have something in concrete evidence. If you're an attorney and you're working with a workman's comp claim and you have a provider that you're working with, you can let them know that this assessment tool is out there. So, it does help all of the parties to be able to have something concrete evidence of what is actually going on with that patient.
I think attorneys really like something like that because they always want to believe their who they're representing. That's kind of their job, right? But at the end of the day, we're all human, and if we see a clear sign of an X-ray with a broken leg, we're going to believe that that leg is broken. If we're an attorney and we see a clear sign that this poor patient has injured and there's this big delay in their reflex, we know that we're fighting for the right thing for that. And vice versa, on the other side, if the insurance company doesn't believe this patient's actually injured, because I'm going to shock you, Shannon, there are people out there that take advantage of this. They really do.
No.
But if we're able to show an objective number of normal versus abnormal, it kind of makes it, let's just say, honest. Let's just say it keeps everybody honest. And I think both sides would agree that that's appropriate. And if a patient, absolutely is hurt, they want that honesty too. So I think it's a very good test. It's a very good, like you said, assessment. It should be a first line for anybody in the workers' comp world. And I'll even go so far as beyond the urology side of this. Those general doctors who see workers' comp, who have a person who has a back injury, it makes sense that maybe we've got something that's going to eventually start causing ED and urinary problems and fecal problems. But they don't know that yet because they haven't gotten a clear assessment of that nerve response. And once they do, even the non-urologists, the general frontliners, may want to have access to this information. It might be valuable. And then they would refer them, if it is abnormal, you probably do need to see a neurologist or a urologist about these issues, depending on your symptoms. So.
Correct. Because usually the workflow is going to be, if you have been injured, they're going to have you go to your primary care. The primary care is going to typically do or family practice, one of the two. They're going to typically do their assessment. Then they're going to do the referral. Mm-hmm. So at least if on that starting phase, they can go ahead, do this assessment, knock that out. Now they know where to send you to. Do they send you to urology? Do they send you to neurology? What is going to be the best course of action by being able to have that assessment done? So, it also helps, you as a patient be able to go and start with the right course of treatment to be able to get that care. So it's great to be able to have it all the way down at the basic level. And, even in the case of somebody being even, unfortunately having to go to an ER, this is a great area to even have that assessment done right there in the ER. It takes 5 minutes. It's quick, it's easy. They can roll it right into the patient's room and it's done right there. And they have the information right there at their fingertips. So, it's something that is great on many different levels, and it helps, facilitate things faster in the workman's comp arena. So we want to thank you for being able to join us today. Any last words, Dr. Mike?
I just think it's a great test. I think you're right about the ER. I think urgent care also sees a lot of people that
Good
have,
point. Good
yeah. So
point.
I think that that's another location. I actually had this is where this all kind of came up, is we had a lawyer that worked with an urgent care here locally in Vegas, and they were using the Euroval, and it absolutely assisted him in the process of being able to not only make the claim to to the insurance company, but also to let patients know, hey, you might be more injured than you realize, because a lot of times they don't realize until later on how bad it really was. So
Yeah, because we all who doesn't have a backache.
right, right,
But when is that backache more than just a backache?
right.
So exactly.
Yeah. So
So thank you again, and please remember to like, subscribe, and share so we can keep creating these videos for you. And everybody have a great day.
have a great day. Bye-bye.